Hola a todos, hola amigos y amigas de Full Dentista. Los invitamos a un nuevo video donde vamos a hablar del paper número 7. 7 de 10, ya va quedando menos. Entonces, empecemos. El paper número 7 es el Cochrane Reviews on the Benefits and Risks of Fluoride Toothpaste. The abstract. The relative effectiveness of fluoride toothpaste on different concentration in preventing dental caries in children and adolescents. The relationship between the use of topical fluoride in young children at their risk of developing dental fluorosis. The relative caries preventative effects of fluoride toothpaste of different concentrations increase with higher fluoride concentration. Introduction. Topical fluorides and caries prevention. Fluorides has been the most important caries preventative methods since the introduction of water fluoridation in 1940s. Substantial reductions in dental caries in developed countries in the last few decades. Fluoride toothpaste being the most widespread form of topical fluoride usage. An adverse side effects associated with the use of topical fluoride is the development of dental fluorosis, a hypomineralization of enamel due to the ingestion of excessive amounts of fluoride in young children with developing teeth. Dental fluorosis do not pose a public health problem. More severe forms will be of aesthetic concern, especially when the upper anterior teeth are involved. Relative effectiveness of fluoride toothpaste of different concentrations. So, methods. Traditional approaches to meta-analysis have focused on direct head-to-head pairwise comparison within randomized controlled trials, RCTs. However, when many different interventions exist, the number of potential pairwise comparisons become prohibited and interpretation very difficult. Adjusted indirect comparisons are made between trials with a common comparator. With advances in statistical methodologies, we have combined both direct and indirect evidence from RCTs in what is known in literature as network meta-analysis, mixed treatment comparisons, MCTs, or multiple treatments meta-analysis. Types of studies. RCTs and cluster randomized controlled trials were included, comparing fluoride toothpaste with a placebo or fluoride toothpaste of a different concentration in children up to 16 years of age with a follow-up period of at least 1 year. The types of participants. Types of participants. Participants were aged 16 years or less at the start of the study were included, regardless of initial level of dental caries. Background exposure to fluorides. Dental treatment levels. Nationality, setting where the intervention is received, or time when the intervention is started. Types of intervention. Studies making a comparison between two fluoride toothpaste differing concentrations, or between fluoride toothpaste and placebo toothpaste. Toothpastes were considered concentrations, part per million, ppm, frequency of use, amount or duration of application, and with any technique of toothbrushing or post-toothbrushing procedure. Types of outcome. The primary outcome was caries increment in the permanent or primary dentition as measured by the change in decayed and filled tooth surfaces. Results: 75 papers reporting on 83 independent trials were included in the review. All reports were published between the years 1955 and 2008 and were conducted mainly in the USA and UK. The minimum duration was 12 months and the longest was 7 years. The review included 58 placebo-controlled studies, 17 studies making a comparison between 2 or more fluoride concentrations. A statistically significant reduction in fluorosis was found if brushing of a child's teeth with a fluoride toothpaste commenced after the age of 12 months. Inconsistent statistically significant associations were found between starting using fluoride toothpaste toothbrushing before or after the age of 24 months and fluorosis. No significant association between the frequency of toothbrushing reported in a 4 cross-sectional surveys or the amount of fluoride toothpaste use reported in 3 cross-sectional surveys and fluorosis was found. Discussion, and this is the important part, paying attention. The review found evidence or a statistically significant benefit of using a 1000 ppm fluoride or more toothpaste relative to 250 ppm fluoride toothpaste for caries prevention in the mixed permanent dentition. No significant association was found between frequency of toothbrushing and fluorosis. Also, no significant association was found between the amount of fluoride toothpaste used and fluorosis. Regarding the fluoride level of the toothpaste used, results from the 2 RCTs found that using toothpaste with a higher level of fluoride was significantly associated with an increase in fluorosis. The study, in which children were recruited at 12 months and the fluoride toothpaste intervention was given until the age of 5 to 6 years, Tanever et al. At 2006, demonstrated a higher risk of developing fluorosis compared with the other study in which children were recruited at the age of 2 years and the fluoride toothpaste intervention program was given for a 3-year period, of Holt et al. At 1994. However, it is noted that the level of fluoride used in the former study was 440 versus 1,450 ppm, while the later study used 550 versus 1,000 ppm. The benefit of increasing the fluoride concentration in preventing caries was only statistically significant for concentrations of 1,000, 1,055, 1,100, and 1,250 ppm and above. Based on these results, it may not be appropriate to recommend the use of fluoride toothpaste at a lower concentration of 440, 500, or 550 ppm for the prevention of caries in the primary dentition, while acknowledging that there is considerable uncertainty surrounding the estimates at these levels. The use of 1000 ppm or higher fluoride toothpaste in children under 6 years must be made taking into account the risk of fluorosis. The results support the international standard level of 1000 ppm fluoride for younger children and up to 1500 ppm for older children. The evidence of increased risk associated with its use between the age of 12 and 24 months is equivocal. The use of higher concentration fluoride toothpastes above 1000 ppm when evaluated in RCTs was found to be associated with an increase in fluorosis. For very young children, consideration should be given when brushing with concentrations greater than 1000 ppm fluoride to the risk of developing mild fluorosis. A risk-benefit decision needs to be discussed with parents and guardians. Muy importante este paper. Nos explica la importancia de, por favor, no usar pastas de dientes fluoradas mayores a la cantidad, a la concentración indicada para el niño. Eso es lo más esencial que tenemos que aprender de este paper. Entonces, lo que yo quiero que ustedes se queden de este paper es, para ciertos tipos de edades existen diferentes tipos de pasta de diente, ¿ok? Entonces, al primer año de vida del niño, por favor, no usar pasta de dientes, no usar pasta de dientes. Luego del primer año de vida, ok, es aceptable y partan con una concentración baja de flúor, 450, 440, hasta 550 partes por millón de flúor, ¿ok? Hasta los 3 años, 4 años, 5 años. Y lo importante, y ahora recapitulando los papers anteriores, es súper importante de que el niño, cuando se esté cepillando los dientes con pasta de diente, que el adulto vigile de que el niño no se la trague. Porque esa es la parte importante, porque la pasta de dientes a los niños les gusta, porque es rica. Entonces, hay que evitar que ellos se traguen esta pasta de dientes. Y para eso el papá tiene que estar encima. ¿Por qué? Porque el niño todavía no ha desarrollado el reflejo de la deglución con su lengua. Entonces es importante que nosotros estemos ahí vigilando al niño cuando se cepilla, papá, mamá, para que no se trague la pasta y la escupa, ¿ok? Después que se enjuague, y que se enjuague con poca agua, pero que se enjuague, ¿ok? Elimine los excesos de pasta de diente de su boca y no se la trague, la bote, ¿ok? Eso es lo más esencial. Entonces, recapitulando, a los 6 años de edad vamos a pasar a tener una pasta de diente de 1000 partes por millón de flúor o más para evitar el riesgo de la fluorosis. ¿Ok? Entonces, espero que les haya gustado mucho este paper número 7. Ya vamos en el paper número 7, ya falta poquito ya. El próximo se viene el 8, el 9, 10. Se nos vienen grandes noticias para los que se quedaron hasta el final. Vamos a hacer el lanzamiento oficial de nuestra página web. Ya está arriba, ya está bastante utilizable, ya se pueden tomar horas, ya pueden agendar para distintos servicios, ya se puede utilizar las distintas sucursales que tenemos hasta el momento, con los distintos especialistas profesionales en sus áreas. Acabamos de terminar los posts en Instagram donde abarcamos todas las especialidades. Y lo queríamos explicar para ustedes, que tenemos especialistas para todas las especialidades. Entonces, si bien es cierto, van a estar en distintos lugares, ya contamos con cada uno de ellos para poder entregar un excelente servicio para ustedes. Eso por esa parte. Por otra parte, les vamos a ir mostrando un poco quiénes son los doctores que trabajan en Full Dentista, quiénes son nuestros asociados a esta linda causa, quiénes son los maxilofaciales, los rehabilitadores, los endodoncistas, los periodoncistas que trabajan en nuestro grupo de doctores encargados del sistema bucal y estomatognático y toda la cara. Ya hoy en día, la verdad es que con el tema de la estética facial también abarcamos lo que es el rostro de las personas. Así es que eso con respecto a la página web, con respecto a la presentación de los doctores. Y luego lo que vamos a tener va a ser un lanzamiento un poco de qué es lo que hacemos, nuestro trabajo comunitario, qué es lo que ha sido trabajar en Juan Fernández, qué es lo que ha sido trabajar en Nepal, el voluntariado en Nepal, y qué es lo que estamos haciendo hoy día acá en Chile, en el campamento Naciones Unidas en Colina, nuestra participación en ese espacio con esa gente. Y por último, para los que ya se quedaron para el premio final, vamos a hacer el lanzamiento oficial esta semana de nuestro nuevo producto, que es un cepillo de dientes eléctrico supersónico. Así que, terminando de ver este video, van a ver el videíto de cómo utilizar el cepillo de diente eléctrico. Y la gente que ya ha tenido la oportunidad de probarlo y contarnos su experiencia. Así que eso, muchachos, amigos, amigas, un poco largo el video, pero aquí estamos, presentes, haciéndonos cargo de lo que nos comprometimos y haciéndole check de a poquito a cada una de las tareas, ¿cierto? Abrazo apretado y que tengan una buena semana. Cuídense del frío, abríguense, por favor, ¿ya? Porque ahora es cuando bajan las defensas y nos enfermamos. Así que a cuidarse harto en la casita, a estar bien abrigado, a comer sano, ¿ok? Cuídense, abrazo apretado. Chao, chao.